I remember seeing in some of the news coverage after the spill initially started and interviewing people in Louisiana, saying that this was so different in their minds from a hurricane in many ways because they grow up, if they live in that area, they know hurricanes are potential. And even though some, like Katrina, are extremely devastating, in general, they live their lives, they know hurricanes can come and go, and they say, we can fix that, we know how to do that, but this is so uncertain. Is that making a huge difference in the mental health impact and maybe even the physical impact as well?
I would say absolutely. And it's an interesting parallel because they're both gigantic disasters.
Right.
In Hurricane Katrina, people bonded together in many cases, and people rallied around within, again, it comes back to the community. They had a shared experience that was visible, and they also had very real opportunities to contribute to the cleanup, the rebuild. You could see evidence of your work. And with this recent oil spill, many people felt frustrated because although they may have been affected, not the actual cleanup workers, but many other affected folks and families felt helpless. There was no role for them. There was nothing that they could do. And the communities themselves really had no visual evidence of sort of what was really going on and of the actual and very real trauma.
Yeah.
And I think that's what's made this very different. And for people who do encounter mental health, many people are resilient and recover very easily with just a blip of a hiccup from trauma. But we know that there is also this large percentage of people who don't. And for many of those folks, there's a lack of sort of where do I go? How do I talk about this? No one understands. So at NAMI, there's the biggest, I think, message for people is to make sure that all of those folks that are affected get the message that they are not alone.
Okay.
Yeah. And then probably the other thing that sort of isn't taken into account is not just a one-time traumatic event. This is sort of like cumulative trauma. This is trauma over the long haul. This is just like, the equivalent of someone just, constantly re-injuring themselves in the same place over and over again. So it's about resiliency, and it's about the promotion of mental health and wellness that, while things appear to be, very bad now, and they are, how can you manage this stress? On a continuum, it won't all be better tomorrow, but, what can you do? What steps can you take? What tools can you galvanize to sort of mobilize and, help yourself and your community?
Okay.
One of the things that we are pleased about is the increased surveillance, and that by that I mean people the departments of health checking with their medical providers so that we can identify some of these in a more concentrated way. Sometimes we don't notice that there are trends of things when things happen, and this way they're at least looking harder in this area for it, and I hope we'll find more cases where we can identify people who've developed work-related asthma or some other problems related to their exposure, and we can better serve them.
Janice, you mentioned the word surveillance, and that's a term some of our viewers may not be familiar with. Tell me what you meant by that.
Surveillance is an epidemiological term. It's an old public health term. But what it really means is being able to put pieces together and make sense out of what are a lot of different symptoms, a lot of different issues. And what happens is if you tell your doctor that you're suffering from these symptoms and add that information that you've been out there working on the Gulf, then that helps the doctor say, this information is a symptom of somebody who's worked in that area. Okay. And therefore, maybe what we need to do is report that to the health department so that they can start tracking all the people who worked in that area and identify whether there's a common theme, whether many of you are having that same kind of problem. It's the only way we can do this effectively in the public health world, to be able to identify these trends that keep us able to put the pieces together and make sense out of what are complex problems.
Do you think families should now feel confident that they can go to the beaches along the Gulf Coast and be okay and not have any residual health effects, or are there any potential problems with just going for a couple-week visit and walking on a beach that had some oil exposure?
I'll say I'm no expert on beaches,
Okay.
but I will say that the monitoring along the shore and in inland areas has shown that the air quality is pretty much what we would expect. So at least from the air perspective, if you're going down there, you're not going to be inhaling a lot of very toxic things if you're on the shore.
Okay.
And generally speaking, the monitoring in the boats has shown that the workers aren't getting a lot of exposure now. Directly over the oil, over the spill where they've been doing the burning and all of that is a different level of concern, and they've been wearing protective gear. But we've been surprised and very pleased that the monitoring has shown as little problem in terms of the air quality as it has been.
Okay.
The weathered oil itself is probably not going to have as much of an inhalation problem. Sometimes it's irritating. Sometimes it can be, and sometimes people can be responding to things at a level that's just a real temporary thing, and they should see their doctors, obviously, if that happens. But at this point, the monitors are showing that so far we're getting air quality like we would have had in a normal summer.
Okay. From your collective experiences yourselves and your organizations, how long should we expect a health impact to affect the people of the Gulf community? Can we even take a guess at that? Is it a year, 2 years, 10 years? Is it hard to say? Or what do you think, Erica?
I think first and foremost it would have to end. Like,
Right.
you know, the particular event has to end. But I don't think you can say that because, again, I mean, you look at mental health, I mean, it's very complex.
Right.
I mean, you know, you're talking about, you know, stress, you're talking about losing your job and the implications of, you know, of increased and marital discourse, you know, even, you know, possible implications of child abuse, different things. The fallout is huge. So, I mean, I think it would be very hard to say that in 3 years this should all be over. In 5 years this should all be over. So.
Okay.
I agree. I mean, we're still looking at now 9 years after 9/11 and still having people who have health problems that came from that disaster. And I'm not sure that this is going to provide that same level of some of the lung health implications. Hopefully not.
Right.
But it's going to be a while.
Okay. And what do you think, Katrina, from your standpoint?
I think if we look at the Exxon Valdez spill, they're still talking about the impacts 20 plus years away.
Okay.
I think the real message, if I can be encouraged, I think that there has been some evidence that I've seen or that we've seen at NAMI that there is a recognition that there are very real mental health, there is a very real mental health impact with this. And I don't know that everyone has the answer of what to do about it, but at least I think they are acknowledging that it's a problem, because the sooner it can be addressed and the sooner there can be some resources put into place to assist with helping people get educated about what that means, helping them access some early treatment and intervention, we know that that is going to have a better long-term effect. So I think the jury is out, and I think time will tell. But there seem to be some signs, at least, that no one's denying that this is a very real problem. What is more challenging, because it's such a complex problem, is how do we address it and what's the best strategy, given the different states that are involved and the different kind of degrees of impact and the state systems as well as the federal kind of impact. It's a pretty complex issue.
Yeah.
I do think that we're learning as a nation that disaster response is something we have to be better at, and that it is a huge, wide-ranging array of issues that we have to deal with. And I think this is helpful to reinforce that message to our policymakers and to people who are in their communities seeking help, to recognize that they aren't alone in this and that we can do better. The other thing I see out of this is I've learned a lot more about the limitations on the workplace protection for lung health. That standards for how much chemical you should be exposed to haven't really been updated in a long time. And OSHA's taking a very aggressive stand here in order to even ratchet down using other organizations' levels of standards. But I think for all of us who work in workplaces, it's important that we have learned a lot more about what those chemicals or substances are that can affect us, and we need to be providing that protection, and it absolutely can be a health risk.
If I'm a person that lives in the Gulf region, or perhaps I'm watching this and I was one of the first responder, I went down, tried to help out, did some good work, left, came home. Are there symptoms that I should be looking out for? Or if I had a family member who was there, what would be the signs that there might be a problem, either physically or mentally, emotionally? Anyone start, and you all can contribute. Katrina?
I'll talk about mental health. Some symptoms that you ought to look for are differences in sleep pattern, differences in appetite, dizziness, substance abuse, increased alcohol drinking, increased illicit drug use, mood altering with substances, and then mood swings. Mood swings, highs and lows, and those would be kind of symptoms that might be consistent. Increased anxiety, maybe panic attacks, night sweats and tremors. Those would definitely be very tangible symptoms that might give you an alarm for you or a family member.
Okay.
And even if there weren't any like physical or obvious outward symptoms, the fact that you bared witness to something so traumatic or experienced something, it certainly wouldn't hurt to just sort of purge and talk about that and sort of process that. I sort of use the analogy of a pitcher being full, and so if it fills up with water or witnessing these traumatic events, at some point you have to dump it.
Right. Okay.
And for lung disease issues or for lung health, things that you inhale, they can contribute things like dizziness, nausea, headaches, coughing, wheezing, asthma attacks. And by asthma attacks, sometimes you don't realize that that includes things like waking up in the middle of the night and coughing. Sometimes that's not recognized as being a high sign that you've got to talk to a doctor about asthma.
Okay.
But any kind of difficulty breathing, and heart attacks are also associated with some of these things. So it's not just your lungs. It's anything you're inhaling can really harm you. And I'm going to add that the stress has been shown in other cases that added stress can worsen these problems, can worsen your response.
Okay.
So it has, the body is a whole thing, and it can be affected in lots of ways by these harmful things that are out there.